Hare Krishna, everybody. Can you all hear me okay? Thank you so much for your kind words and the introduction. I've been in our movement for a few years, and I've also been a member of the Bhaktivedanta Manor Association for the last couple of years also. Please accept my humble obeisances as we embark on our talk. The title of my talk, I thought I'd say something that appeals to all of us. And the title is, so who cares? And the importance of your health and well-being in devotional service. So here's what we'll cover. We'll talk about the things that you care about, first of all. And then we'll give a comprehensive definition of health and well-being, explaining its implications. We'll then go on and debunk some myths, which will hopefully lead to a better understanding of health in devotional service. I'll give you not one, not two, but 3 reasons to actually care about your health and well-being. And then we'll talk about the 5 P's of improving your healthcare. And then we'll wrap it up with a nice little quote. I will go back to the beginning. So, who cares? Now, firstly, what I want you to do is close your eyes, please. Just be still for a few seconds and think about the things, the 3 most important things that you care about. This could be anything. That's fine. And you can open your eyes now. So I'm not asking you to share these reflections, but when we get to the end of the talk, you may have changed the things you care about. So it's an interesting little start to the conversation. So moving on. So the World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. This is a very important definition. It's quite neat, but it actually has quite far-reaching consequences. It's holistic, it's all-encompassing, and in medical parlance, it relates to what's called the biopsychosocial model of healthcare. And that is what the BMA, the Bhaktivedanta Medical Association, is about. But it also talks about the positives and the negatives in healthcare, particularly mental health, which we'll learn about more in a moment. So, health, and by extension, well-being, is not just about the immediacy of your health, but it's also about coping with the daily stresses of your life. It's also about working productively and also about contributing to society. So it's quite a large definition if you think about it. In short, it's about being the best version of you. Okay? Hopefully you can all relate to that. Being the best version of you can be difficult in devotional service. And to become the best version of you, I want to debunk a few myths first of all. Now, in our movement, often people will think that whatever disease you get, it's all due to karma anyway. Okay? So what's the point in resisting the disease? This can, I believe, perversely lead to a stoic acceptance of our fate that some people then mistake for fatalism. There's nothing to be done. I'll leave it all to Krishna. But because, and we believe this, because we believe this planet Earth is full of misery. And death, we think, is not a terminal endpoint, but actually our transition to our next life. So therefore we believe that this life is a comma, not a full stop. I believe, I'm going to argue that yes, although this is valid, it is a false dichotomy, and it gives us a false perception of reality, which is not actually representing the best version of you. So you can and you should look after your health. You can and you should look after your well-being. Because by doing that, you will improve your devotional service. So please remember that. Look after your health, look after your well-being, and then you will improve your devotional service. So to answer my opening question, who cares? I would say you care because Lord Krishna cares for his devotees. So let's look after our health and well-being. Now, let me just say something controversial. Look at that quote over there. Certain religions that believe in reincarnation think that disease X is a punishment for bad deeds in a previous life. Now that was actually in a paper that I was asked to comment on in my sort of life prior to publication. Can we identify with that statement? Do we care enough to say something about that statement? I did, and they actually removed some of that. Of course, we should care. That's my point. Because our actions now can actually be due to multiple causes. We all know that karma is actually quite complex, and causes can be immediate and distant. Immediate causes of disease and suffering can actually be corrected. For example, eating properly, exercising, looking after your mental health, and these things can help you prevent certain diseases like diabetes. Now we have diabetes tent there, we have screening tents there as well. So, what I'm saying is that in devotional service, we should not have just a meek resignation of our fate and a passive surrenderance to karma, but we should have a realization that certain things about us we can and we should change. Other causes of our suffering can be more distant and unavoidable, but we should gallantly accept them and still try and mitigate against some of their worst effects. So to answer the question, who cares? We should, because we can change certain things about our life. So, who cares? We should care, because Lord Krishna cares. And remember, the body is an instrument for devotional service. And also remember, your body is not your property, it is Lord Krishna's property. So, taking care of our bodies is not an option, it's not actually a material activity, but it's actually a spiritual activity because we are using this instrument in devotional service. You will remember that Lord Chaitanya rebuked Sanatana Goswami when he tried to commit suicide under the wheels of Jagannath's chariot, Lord Jagannath's chariot, and he said to him, your body belongs to me, and one who destroys someone else's property is considered a thief. So, who cares? We care because Lord Krishna cares. And by looking after our bodies, we can give regular, uninterrupted devotional service. That's the important thing. This does not mean that we give up in any circumstance, because sickness is material, but devotional service is actually transcendental. So this then purifies our existence. So who cares? We care because Lord Krishna cares. And looking after ourselves can increase our love for Krishna and turn our theoretical knowledge of Shastra into practical realization. And we've all read the Lecture of Instruction. It talks about the do's and don'ts, what to eat, not to eat, and how we can regulate our devotional service. So, how do we care for our health and well-being now that we've realized it's important to do so? Let me introduce you to the 5 P's. Firstly, we have proactive care. Okay? Proactive healthcare, not reactive healthcare. We in the BMA believe in preventing a problem before it occurs rather than reacting to the problem once it has occurred. So yes, that means screening for important diseases. And we have information next door on breast cancer screening, prostate cancer screening, bowel cancer screening, cervical cancer screening, leaflets there. Please avail yourself and read some of those leaflets. Screening also means looking out for funny heart rhythms. And we're checking your heart rhythm on the screening table that I'm there with, doing an ECG, to try and look for atrial fibrillation, which is a silent killer and can cause strokes. We're using some amazing AI-enabled technology to actually detect your heart rhythms today. It also means checking your blood pressure. And that's been a very popular aspect of what we've been doing next door. In the first 6 patients I saw, 4 of them had undiagnosed hypertension up till now. That's about looking after your care and your health. We also have people from the council, Hertfordshire, who are talking about preventing heart disease, and we also have a diabetologist who's helping and giving guidance on diabetes. Prevention also means actually vaccinations. We're not vaccinated today, but it is important as devotees we get ourselves vaccinated against COVID and flu. And did you know that there are egg-free vaccines that haven't been tested on pork and gelatine that devotees can have? You can get that from your GP surgery. So, proactive healthcare, which is what the BMA believes in, is about you being in charge of your health and anticipating problems before they occur. So please, if you have time, go next door and come to our tents there. Another practical example is, a lot of devotees come to me with a lot of acidity problems after Ekadashi. So why not after Ekadashi have some Gaviscon, but at least identify the problem first. You can actually treat it. This is quite a common thing because we're not eating for 24 hours, then we're going to get certain bursts of acidity, and we can actually improve your health, and that can improve your devotional service the next day. Second P is personal, me time. As explained earlier, health, as per the WHO, isn't just about your physical health, but it's your mental health too. So please, all of you, give yourself time to love yourself. That's the important point. Krishna loves us, we need to love ourselves. Okay? The next P, the third P, is paying attention to warning signs. We in general practice call them red flags. So, that blood in your stool, that blood in your urine, that cough that simply won't go away, that chest pain you get when you're stressed, don't ignore it. Look after your body, your instrument of devotional service. See your GP or healthcare professional. The fourth P I've identified is pridelessness. Disease teaches us to be humble. We may be proud of our mind, of our bodies, of our strength, but sickness actually humbles us. So we need to actually show pride in looking after our health also. And the final P I've identified is partnership. Work together with your doctor and your healthcare professional. Understand each other. This shared understanding always leads to better outcomes. So we need to trust each other. And finally, let's have some words from our founder Acharya. Where it's important, he says, to keep the body fit and healthy, so we will not meet the obstacle of ill health while serving Krishna. Ill health may hinder one's service, so we want to avoid it as much as possible. So, to answer the question I posed at the beginning, who cares? You care because Lord Krishna cares. We have to care about our bodies in a responsible way that is responsive to what happens to us, because that is a crucial part of devotional service. Now go back to those 3 items that you were thinking about, what you care about at the beginning of the talk. Hopefully, looking after yourself is now one of them if it wasn't there before. Hare Krishna, I'm happy to answer any questions.